Hi guys, and welcome to another video. This one's just a chat. Sorry if you're disappointed. I'm the same. I like action. I cut action. I like that better than chats, but chats are important too. Do you like my mini Rubik's? Don't mind my gloves. I've got sore hands. Look. It's just the 2 and 2 and 2 and 2 and 2. Sorry, 4, 4, 4, 4, 4. Good for my mind at the moment because it's always got too much going on. You know, ADHD, OCD is not a good combo. That's the one that's not a good one. Oh, hang on, have I? Hang on, no. Anyway, I thought I got a 4 then of a colour. Working on it. When I was a little kid, these came out when I was about 10. And I got it for Christmas and I mastered it. Young man, what are you up to? No. 2 seconds, kitten's getting up to something. Okay, oh my goodness. I'm trying to get him from under the bed. I'm out of breath. Yes, Willow, I know. He will grow out of this. He's swinging from my fluffy lights. I call them fluffy because they have like tutus on them. IKEA. Anyway, basically, what are you doing? I always worry they're going to get something around their neck too. It's like, it's like being a mum again. You hear all these thoughts go through your head. Anyway, anxiety does that to you. Anyone between 2Q knows that what you got now? That's just my iPhone. I don't have an iPhone anymore, but it's my mobile charging thing. There's no chew on that. Oh, kittens are fun. Anyway, I'm trying not to be distracted. So the topic of the day is masking in autism. However, I'm going to say this to anyone because, to be quite honest, I think that anyone masks. We all have caps we wear. Professional caps when we're at work, mummy caps when we're a mummy. He's in the cave. There's all sorts of caps. Caps you wear as a partner, caps you wear as just all these different things we have to achieve with our life in different relationships, right? We are different. So maybe if you're not autistic, you can relate to it in that way. Think of it in that way. But with autism, it's really tough because quite often, most often, and this topic I'm bringing up because Tony Atwood talks a lot about this and brought it up recently, and I just wanted to go with it about autism because I think that it's such a big one for autistics. It's such a big one. And let me just tell you this, as someone who's old, I was diagnosed a very long time ago, but that doesn't make it any easier. Because being an adult autistic is tough. Look, being a child autistic is tougher, yes, because you're going through development, you don't have the same abilities as, okay, I'm going to go set up his toy box, 2 seconds. He needs something to play with. Aren't those laser lights just amazing? Anyway, so basically, let me just tell you this for masking. If you mask and keep doing it, you get depressed. And let me tell you why. Because you're not being yourself. Anyone who's not being themselves, neurotypicals, normal people, if they're not being themselves and they're in a situation and they feel forced to have to be something they're not, I'm out of breath. Kittens, okay? It's like toddlers. Oh. I've only just woken up. Good morning. Oh dear. Sir's at the hospital. Okay. So send him best wishes. He's doing his pre-admission appointments. So he'll be gone for a few hours. But anyway. Indigestion. Ugh. Okay. So basically, if you mask, you do get depressed. And that's because us autistics that have done look, it's whether you've done informal ABA, which most of us from my generation have done informal ABA, you might have done formal ABA. And that's all good. We needed that. Us as children didn't know how to communicate. We had to have that. That was a lifeline for us, right? No denying that. But basically, when you become an adult and you're left to your own devices with it and other adults interact with you. Now, it's a little bit easier in your 20s. Don't be fooled. Work on it before you get past your 20s, giving a heads up to the youngins there. Because when I was in my 20s, I was a different person. I would not be in front of a camera. I would not be able to have done all the things that I've done. I ran a non-profit for women, spoke in front of them, doing speeches, talks, all this kind of stuff. Like, really had to go to meetings in the community to do with the Shire. It was really intense. It was networking, and it's kind of like, whoa. Even to the point where they offered me a job to help other startup non-profits, because basically that's my studies. That's what my studies taught me, was how to start non-profits, right, and run non-profits. So it was my thing before I got too sick to keep going, and I loved it, and the people I loved. And I'm just saying, like, that I couldn't have done at a younger age. So if you're autistic and you're young and struggling, it's all good. The 20s, 30s, the 40s, because I'm nearly in the 50s, I know all those. And you do change, okay? Every decade, I mean, every 5 to 7 years, all of us change. We all change, okay? There's always a core of us that doesn't change, but there's always parts of us that change from our learning, just from life. Whatever life gives us for lessons, you know how some things are just lessons? Yeah, from those things we learn. And that's good. Not good in the moment, I get it. In the moment, it can be traumatic. It can even be just upsetting. It can go from one extreme to the other. It can be extremely traumatizing or extremely just upsetting. Doesn't matter, but it's a lesson. And I feel for you guys who are in those age groups, because it gets better. It gets better. I promise you it gets better, but especially autistics, it gets better. But I'm just saying, it also doesn't get better in some ways when you get to my age. So just know, even regardless of age, if you're doing your best and someone's making you feel like you're not, remove them. They're toxic. Just like a normal person would remove someone who's tapping away at their self-esteem for no reason. You know, like nitpicking can be one of those things that are just toxic. Bullying is toxic. We all know about that online, don't we? We all know about the online people. Just know they're very sad people. Never, you know what I mean? Always remember that. People that want to drag you down, all right? And people can hate people. There's no law against that. But to go and speak it, there should be a law against that. But I'm just saying, just know, psychology here, that person, that exact person that said what they've just said to you, is living a miserable existence and wants your life, probably. They probably want to live your life. And some of them aren't like some of us. And some of us, when we don't like our life, what do? Self-development, make changes, make improvements, set goals, and better ourselves, or go and achieve something. Like, I don't know, for me, when I was in my 20s, and this attracts a lot of jealousy too, guys. If you're a self-growth person, you're going to attract. And if you're an autistic like me, who's worked very hard to not look autistic, you will pay a high price. But you will achieve, I know for 22Q, I've achieved more than what is expected. That's why I'm saying, especially any parents out there, don't let them limit your child. Don't you, as your own person who's got 22Q, limit yourself. Anything is possible. It might just take longer, be harder, need more supports, but it's okay. So basically, I guess what I'm saying is you will attract. The more you succeed, guys, this is just for general people, let alone us autistics. Okay, the more you succeed, the more someone will try and drag you down. And every time I've done like a level up, you know, in life for myself, because I don't measure myself on others. Don't ever do that. I measure myself on my goals. So if I'm starting like a new season for me, and I've just chosen to start a new season rather than choose like it's the new year, I'm going to set New Year's resolutions, right? I don't always do it that way. I always do have resolutions for the new year, but at the same time, every now and then I go, hang on, I need a new season because this season I'm in right now, I'm a bit stuck, right? I'm just something's like holding me back, right? And you got to think about what that is first, which, hang on, the thing's over there. Imagine that, and it pours down. Oh my goodness, I got no hope. Maybe self-development is over for me. 2 minutes, I gotta blow my nose. I'm sorry. Okay, done. Still sunburn is still going away. So basically, like, I start a new season. So if I'm in a stuck mode and I know that something's just, I don't know, sometimes it just declutter your house. Sometimes it's that makes you, it's called a paradigm shift in psychology. So sometimes when you think, oh my gosh, the energy in my house and in my mind is, because it's all connected. I do believe that the reason why we feel better when we go through our clothes and get rid of old clothes sometimes, when it's due for that, or when you go through the house and get rid of things, or a particular room, notice how you feel better. It's because it's connected psychologically. Those things hold you back. And it's not that it's because of the specific items. It's not because of that room. It's just because that kind of flow in that room or in your house, if you haven't had the time to get it all organized, because people just don't have time sometimes. It depends on the phase of life you're in. Things can get messy and disorganized, and also things like decluttering, going through linen cupboards or something. We don't have time for that all the time, right? Fact. So, but when we do it, we feel better. And the reason is it's got nothing to do with the items. Still do those things with the items, but it's more to do with mind. It clears the mind to say, wow, out with the old, in with the new. Because normally when you do that, you end up making a small list, at least, of things you need to go and get for that particular area. And all it is shifting your mind to do other mental things differently. That's what makes you happy, because it kind of gives you that openness. It's like, oh, the flow's back. I'm feeling different mentally, and it does. So that's a good tip if you want to flick yourself into that mode if you're stuck. And you're stuck to the point where you can't just do it mentally. I can just do it mentally now because of my age group, I'd say, more to the point, rather than being because of my self-development, because I've done that since 18. So I don't think it's based on that. I think it's based on just experience, because I've done it so many times before. I've run a household for 33 years now. Yeah. And I've loved it. I'm an organizer. OCD. I enjoy it. It de-stresses me when I clean out a room, or just a section of a room, or I declutter. It actually just does something for me, as well as paradigm shift I don't know, like I might set a new goal, even if it's just one, and I'll go, you know what, I need to do more of that. Yeah, that's what I need. And then sometimes, if I've been so busy with things that take me away from myself, and I have no time to do anything on myself, or to do with my environment even, then when I finally get to do it, and I get into it in a big way, it's a big paradigm shift. It really is. And you need to utilize that to question everything. because we need to do that. It's almost like because of the busyness of the world, it's abnormal. We're not built for this life. We're not, especially autistics, but I'm just saying anyone. We're not built for the type of busyness. And I know that it's hard to admit this because some of us, like ADHDers, like to achieve 10 billion things in a day. When I used to go and I used to speak to other mums and they'd say, what have you done today? And you give them the list of things you've done and they go, what? All just today? Yeah, I'm a bit tired. I think I pushed it a bit. Anyway, that was stupid sometimes. Sometimes that was stupid. But however, I was always that kind of type A, ADHD. No, it's got to get done today. And I would write my list and it had to get done. And I would not sleep until it's done. It's called OCD as well. Anyway, yes, I've had many chats with my psychiatrist about that many moons ago. He used to laugh at me about a lot of my OCD things, so that's good. Okay, so I'm organised OCD. But basically, it doesn't help, like the thought part's not fun. Things go around in my head. But in a way, it's made me a good problem solver. So basically, when you're masking, guys, this is when you're going to have this feeling of like kind of numb. You are going to feel sometimes a bit fake. You might capture yourself mid-conversation with the person who's normal and you're trying to match that, because that's natural psychology there, guys. We match other people's behavior. If they're angry, we match it with anger. If they're happy, unless you're suffering depression, you'll match that with happiness. If they're frustrated, you will eventually feel that frustration. Now, of course, there's different personality types. It's actually 16, but some people who I don't know how they do it, like Sir, they remain very calm. It doesn't matter what feeling I'm having, which sometimes is frustrating when I'm like really overexcited and happy and want to do crazy weird things at, you know, certain times of night when he's like, it's nearly bedtime, and I'm like, no, I've just decided I want to party. So there is times where, yeah, it's inappropriate, but I'm just saying that's ADHD. But basically, there's some people that are calm and just they stay in their own zone, kind of a thing. But most of us, even them, get those feelings even if they're not showing it. But basically, people match that. So you are trying to match their behavior, and that's just natural. You can't blame yourself for it. But what you do need to do is be authentic. And as an autistic, when we're not with people, we're so authentic. And that's why the people that know us, my friends that have known me for 30 years and 20 years, and my you know, family like Sir and his sister, and people that know you for years and years. I've known his sister since high school. This is a long time. So, they know you, right? And they get to see the real you, which is good. Because those are the people that it's easy to be yourself around, as in your autistic self. And when we put those hats on, when you go to work, that's okay to put that hat on and be profesh. Yes, we all need to do that. But life, that's reality, right? That's a reality thing. But I'm saying, like with autism, you don't need to do that. You don't need to do that. You can be like yourself, and if people don't like it, then they don't like the real you. You need to know that, and that hurts. I hear ya. But some people, with me for example, when I got diagnosed, I went into denial. And I was like, I'm going to pretend to be even normaler than normal. Oh dear. Anyway, love the gym. That was super cool. Recommend that for ADHDers. Go to the gym every day. Step classes are fun. bit of cardio. Trust me, I used to go for runs. I used to run around like this certain circuit around where I used to live. So I used to ride his bike. That's just a thing that I've always had to do. It's a PTSD thing because of an incident that happened when I was 13. I was nearly snatched walking home from school, and it was very traumatizing. And ever since then, in non-public areas, as in lots of people areas, I cannot just walk. And that's because I didn't get the help I needed at 13. Like, it was so traumatizing. And being autistic, I didn't express it very well because I didn't have the words, the express the feelings. I didn't know my needs. But basically, I didn't sleep so much, I hallucinated. So anyway, we all have our traumas, and that was one of mine. And so naturally, I couldn't just go for a run on my own, and that was quite sad. But Sir enjoyed a bike ride, so he'd just ride his bike behind. But basically, these things for ADHD is you need that. You need to get rid of that energy, because then you can have your focus. And you won't have that irritating, annoying thing of getting up and down, getting up and down. I know when I was at university, and, you know, some assignments can be 30 hours just for one essay, especially in third year. Horrible. But that energy that it takes mentally needs a packet of Tim Tams. But also, you need to get rid of that energy so you can sit there and do that. I know, it's a rough life. I know. I saw what you just did. You just cleared the whole table that I decorated, but that's okay. So basically, when you don't mask, no, the table's not for you, it's for food. No, no. So basically, yeah, if you're masking, you might feel those sudden feelings of, I feel fake, because you kind of are being fake. And I'm not saying you're doing it like willfully, like some people do. You're doing it because you want others to feel comfortable, okay? Trust me, us autistics are people pleasers. And you know why? Our childhoods are so traumatic. Being an autistic child can be very traumatizing. We not only have to learn the ABCs and 1, 2, 3s, but we actually have to learn how to be a person. And we have special ed teachers and so much work to do, more than other children. And it's brutal. We've got extra things we have to do and achieve. And that can be traumatizing. ADHD children, hello. I sat on that bench many times because I just got into trouble for swinging on my chair, couldn't sit still, all of that. In my day, it was sit on the bench, which the bench was right outside where your bags would sit of the classroom. And if I wasn't in my, like special ed, it never happened because they had accommodations for us. But for other subjects, I was back with the other kids, all the other kids, my class, right? And I would be sitting on the bench because I'd be swinging on my chair, chewing on my pen, chewing on my pencils, looking out the window at the bird, picking up the stick, taking it to his nest, and watching him build a nest. And the teacher's like, and I'm like, ignoring that because I'm autistic and I don't know what that means. What is that, teacher? And the one standing at the front of the room. And they go quiet, and I'm just like, oh yeah, listening to my friend's stories, right? And then they stop, and I'm like, still looking at them, waiting to finish more story. And then the teacher goes, Dyan, front, look at the front. And I'm thinking, how does everyone know when the person at the front of the room, the teacher, standing there, saying nothing, means go quiet, sit still, and look to the front of the class? Would have been nice to know that. Okay, teachers, you need to tell an autistic that that's what that means, okay? And that, or claps, or throwing dusters at my head doesn't tell me and teach me anything. Yeah, that happened. Yeah, I know. out of pitch. Like, can you believe it? I heard the sound of whew, past my ear. Like he didn't hit me. She missed. But basically I was turning around, swinging on my chair, watching what the boy behind me was doing. He was making something with plasticine. Yeah. Anyway, that was grade 4. That was fun. Yeah. Like, the teacher was very mad at me. I think she was having a bad day because I was a good kid. Okay? I was a good kid. I was not a difficult child in that way. Just my ADHD was showing. My selective mute also, I think, sadly, to be quite honest, made a lot of teachers angry and impatient with me. And it's just sad because autism in the 80s wasn't known about. ADHD in girls, even though they said she's hyperactive, which is what they call it, like the boys, they call it hyperactivity back then, right? And it's now ADHD. But I'm just saying, like, the boys, they would get into more trouble because boys, in their biology, they are even more physically active than a girl. So it's just biology, right? So basically, they'd also be kicked out of class a lot. And yeah, there was a few of them in a few of my classes over time. But us girls got away with a little bit more, but still got a lot of punishment for my ADHD. And my developmental delays, there was a lot of horrible things that happened at school, like wetting myself as far as 11, because I'm autistic. And interoception, didn't know when I need to go toilet. Very simple things. It's very traumatizing. It's very traumatizing. So I understand why you mask. A lot of it's trauma. It's self-protectionism. You're going to mask to protect yourself. You're going to pretend to be older than what you are if you're like me and your mental age is lower than what someone with, with developmental delays, this is what happens. And with autism, 22Q, we hide that with shame, right? Because we failed at it. The older you get, the more you can control certain parts, but you can only control all of it until, well into your 30s. That's sad. Because you know what? Sorry, coffee here. That is a lot of time of traumas that's happened to teach you these things. Now, if you're a child of different eras, you might have had a different experience because of the knowledge of autism compared to the lack of knowledge of autism for myself from professionals around me. Even though they knew something was very wrong, which is kind of, to be honest, the government's failed me in many ways through the education system. With 22Q being diagnosed so late, as you know, you might be thinking to yourselves, that's weird. And that is, sadly, a representation of the health system in Australia. I'm sorry. If you go there for normal, acute things and you're in and out, you're not going to see this or know about this. But some of you with children and some of you with some of you who are like me might have a different syndrome. You might have autism, ADHD, or just autism. You might have autism, ADHD, OCD. That's the normal combo. Or you might have ADHD, OCD, whatever. We're all the same. Different personalities, but we're all the same in the sense of those struggles, right? So masking is a natural response to get by, to get through studies, to get through jobs, to get through just having some friendships, basically. We become people pleasers. So that's the books you need to go look for if you want to start any self-development and you relate to this people pleasing thing, because masking is kind of pretty much that. Okay? Think of it as masking is people pleasing. Okay? You're being what they want you to be. Not totally. I'm not saying you're like when you're masking, you're fake and you're totally not yourself. That's not what I'm saying. We are ourselves. We can't help but be authentic. That's even to our detriment, to be honest. Even to our detriment. Because sometimes being authentic is also comes with a lot. You know why? It's easy to be hated for who you're not, because you can go, well, that wasn't really me. I was just trying to fit in and trying to be like all of you guys. You know what I mean? Like that you can brush off. But when someone actually attacks your core, which is who you authentically are and what is authentically going on for you, that's when it hurts, because it challenges your integrity and it's like, excuse me, Karen, Darren, jeez, you're a bit brutal. That's why, because that's the real you that's being picked on, and it hits that bruise from childhood and you go, I didn't like the shame then, I'm not having it come back. Don't have it come back. Being autistic is nothing to be ashamed of. Having ADHD is nothing to be ashamed of. Having anxiety, there's nothing to be ashamed of. If you, just put it this way, if you didn't have any feelings, no feelings, so many feelings. I have a lot of feelings, but I don't go here. Mean Girls. That's the movie, right? I'm just saying, like, what it means is just keep being you. Because the wonderful thing on the other side that I haven't talked about is when you unmask and be the real you, all of those like feeling low mood or anything, or distressed or feeling ugh, because you're not getting any satisfaction with people pleasing, which is the same thing. No. So when you're yourself, the good side of it, I will tell you this, because I've been doing it so long now, you actually get the real good people around you that are your people. And you have the best of experiences ever. The best bonding, the best conversations, the best, like, understandings. And I don't know if you're like me, but I'm a deep thinker, and I like to have deep discussions about the universe. Literally. Like, I love it. If I can learn something by listening to someone else's special interest, I'm in heaven. So know that. That's the other side. So don't go back to masking again every time someone hits that bruise of the shame of being autistic or autistic ADHD or ADHD or whatever your thing is. Don't be ashamed. Stay true to yourself. Unmask at all times. I insist, you must. Cut the crap. Cut the people pleasing. It's going to make you depressed. It's going to make you go on maybe some tablets for it. That's not good. We shouldn't be taking tablets unless it's absolutely essential, and that you don't do that lightly. Trust me. I studied this, and I'm a big believer. If you need it and your doctor's recommending it, still question it, but do your research, speak to your doctor more, and speak to them more and more. Don't just take it at just like, oh, they're just throwing you the script. Don't. Do your research about what's best for you, because depression can be managed behaviorally as well as tablets. There's so many books that can get you out of depression, trust me, right? And as you get older, it gets easier, trust me. But I'm just saying, question advice given to you. It doesn't matter if it's a doctor, anyone. Question the advice. You must think for yourself. It's so important, because this is your lesson. Your mistakes too. People should let you make mistakes, because how else do you learn? If someone doesn't let you go and do something a little bit stupid, then you don't learn. Now, if it's permanent damage and someone's saying, whoa, don't do that, then that's probably good advice. Because permanent damage, nobody wants that. But I'm just saying, like, making mistakes is a vital part of growing and learning. And don't let anyone prevent you from doing those. mistakes. Unless you do too many of them and someone's telling you maybe listen, sure. If you're under therapy, kind of voluntarily, and you're having these conversations and they're telling you that, like, you need to pull back a bit, then you probably need to listen. I get that. But I'm just saying, just allow yourself to fail sometimes and sit with that and go, well, sometimes I'm going to fail because I'm not perfect. When people pick on it and it hits that bruise, don't worry about it. Don't worry about it. You're going to learn something from it that's going to last forever. And people that love you authentically, they won't care about that. So they'll just be there for the good times, the bad times, the ugly times. They'll just be there for that. The other ones won't. Forget pleasing them. They don't care. In fact, they probably want your life to be miserable. Don't let it. Don't let it, because being unmasked also leads you to your special interests. And trust me, when you start going into your talents, that's where your life begins. That's where your life begins. As an autistic as well as anyone. Particularly as an autistic, and I'm saying this particularly as an autistic, even though it's exactly the same for anyone, because we don't know these things. Anyone who's not autistic, we don't know these things. These things that I'm saying right now had to be explained to me for weeks and hours to get me to understand what life, how it works. This isn't natural learning for me. I've had to learn this. And it's improved my life. It improves normal people's lives, let alone people with autism. So trust me, like, that work is great. Now, I'm not saying, quit all, whatever you do necessarily, like with therapies and doctors and all that. But it's like, do your own thing as well. Give it a go. Because you might be surprised and go, yeah, I know when I was younger, it's like, yeah, I don't need you to tell me how anymore. I kind of worked out something I can do myself. Executive functioning, I'm going to take that over. Thanks. And I've got someone I can ask, like, sir, if I'm a bit confused. And then, of course, you've got your speech therapy to call back again and go, oh, no, yeah, there's a blind spot here. Yep, didn't see this one coming. Let's have a chat about that. Some social stories. I'm so confused, and I'm stepping into my 50s, and what am I stepping into? A bit like menopause. It became this thing, and I was asking everyone, my doctors, and even probably specialists that are like, that's not nothing to do with them, and they're a man, and I'm like, oh, I'm just hitting past menopause. What does this all mean? Like, apart from, the obvious, but like, and they're just like, oh my God, who is this person? What is wrong with her? Autism. So guys, keep learning, keep living, keep loving yourself as well. Put yourself as priority. Anyway, I hope this helped with more of an out of the box unmasking video, because I'm not just going to do the stock standard of repeat what everyone else is sharing, and that's all great information. If you're doing a search on unmasking, keep looking. There's tons of great stuff, but I'm just saying this is kind of a different one. So thanks for listening, guys, and keep unmasking. Everyone, all of you, even non-autistics, bye.